What are the typical signs of a heart attack or stroke?
Okay, so for a heart attack, you're going to get chest pain, pressure, or fullness in your chest. Sometimes it radiates to your arm or to your jaw. But there are also atypical signs of a heart attack that you should be aware of. And you could get nausea, you could feel lightheaded, you could feel short of breath. And women are more likely to get more of the atypical symptoms. Generally, if you get a strange symptom, even pain in your lower back, that comes on with exertion and relieves when you rest, it could be a sign of a heart attack. So anytime you're concerned about any sign of a heart attack, you should seek medical attention. As far as a stroke, a heart attack is loss of blood flow to the brain, and a stroke is loss of blood flow to the head or to the brain. So in a stroke, the things to remember are the acronym FAST is a good way to look at it, and that's easy to remember. FACE is for the first one, so any drooping of the face or change in the face would be one sign. A is for arm, so weakness of an arm or a leg. S is for speech, so any slurred speech or garbled speech. And T actually stands for time, which means you just need to go to the emergency room right away, because time is brain, and you can actually have less symptoms from a stroke if you get medical help right away. And I don't know that people know that, but you do need to get in quickly after a stroke.
What groups are at risk for high blood pressure?
Okay, so high blood pressure, we see a lot of that. The older you are, the more at risk you are for high blood pressure. If you're carrying extra weight, so if you're overweight or obese, you're at risk for high blood pressure. Certain ethnic groups, African Americans, are at higher risk of blood pressure. And if you smoke or use tobacco, you can have high blood pressure. Even eating too much salt can lead to high blood pressure. But those are the main risks. Exercising can lower your blood pressure, so having a sedentary lifestyle will also lead to that.
So you mentioned exercise. What are some other tips that can help a person maintain a healthy blood pressure?
Okay, so many of the risks, if you can modify those, then you can get your blood pressure down. So the same type of thing, getting plenty of exercise, avoiding alcohol, or at least in moderation, cutting out tobacco, either chewing or smoking, getting the exercise, maintaining a healthy weight. Those are the main ways to lower your blood pressure.
So with exercise, how much exercise should a person get every day?
Well, the American Heart Association recommends about 150 minutes a week of exercise. That averages out to 30 minutes 5 days a week, but they say it's even okay to get it in 10-minute chunks spread out throughout the day. And even 10 minutes of walking a day can decrease your heart attack risk by 50%. So I don't think people realize that it's actually what a big effect being sedentary can be, and how little exercise actually can be good for you. Of course, you want to do as much as you can, but even a little bit goes a long way.